Are you interested in finding out the optimal treatment approach to alleviate carpal tunnel syndrome? We will teach you self-diagnosis. In order to relieve the pain, you can try self-diagnosis along with performing massage treatment, recommended exercises, and following the given advice. In this case, it is very simple. We are going to do a test known as the Phalen Test. The Phalen Test is what we are going to do is, we are going to join the back of the hands together. In this position, we are going to try to form these 90 degrees with the wrist, and we are going to maintain this position for 1 minute. We're going to stand here and just wait for 1 minute. What has to happen if it is positive and if we have carpal tunnel syndrome? The normal thing is that we begin to notice a tingling sensation towards the hand, especially in the first 3 fingers, in these 3 fingers. We may also begin to notice pain towards the palm of the hand throughout this area. So let's hold on for a minute, and if during this minute you don't notice anything at all, then it is possible that your pain is not the same. Then it is possible that your pain is not carpal tunnel syndrome, and it is something else. Anyway, to complete the treatment, we are going to do the test called the inverted skirt test, which is very similar but backwards. How backwards? Well, instead of joining the dorsum, we are going to join the palms. Palms together. Then we put the palms together and try to form again those 90 degrees with the wrist. 90 degrees with the wrist. And the same thing. Let's hold for a minute. The test is exactly the same. We maintain this position. We need to assess if, after a short period of tingling, another manifestation of tingling emerges within a few seconds. Electrical sensations, sensations of lack of strength. If any of these appear, it is likely that our carpal tunnel is compromised. However, as we always tell you, the ideal would be to complete the diagnosis, to go to the medical professional, and complement it with some tests like an electromyography or a resonance. And to complete our diagnosis, what are the most frequently observed symptoms associated with carpal tunnel syndrome? Well, as I have already told you, the most common is tingling throughout the forearm and hand. And in the hand. The tingling in the hand generally will be in the first 3 fingers and in the middle of the 4th. And in the middle of the 4th to here, because it is the zone of innervation of the median nerve, that is the one that is compromised. Also, we are going to have surely a lack of strength at the time of opening and closing the hand, and to do gestures of prension as to take things in or to move directly the hand. It is also very usual tingling and pain in the hand when we are sleeping, and pain in the hand when we are asleep. Nocturnal pain is also very common in this syndrome. Well, as I promised, we are going to start with the treatment. The first thing we are going to do is a self-massage on the whole area involved. In order to locate a little bit the carpal tunnel area, one thing we can do is to close the hand and throw it forward. You see that here, up here. Like this tunnel, these little tendons here, this is going to be the target area for the massage, although you'll see that it's going to extend a little bit more. So what are we going to do? We are going to take a little bit of cream, we're going to put it here and another drop there on the palm. To clarify, we will apply a small amount of cream to the marked tendon area as previously mentioned. What we're going to do is, with the corner of the spoon, because it's very thin and it's better than our fingers in this case, so we don't hurt ourselves, we are going to make soft little passes. This area is quite sensitive. It is normal that the sensitivity that you notice is a little bit high, but we are going to go making passes downwards and upwards. And upwards, keeping a little bit of discomfort there without it being painful, both on the sides of this little channel that has been formed, as well as above. On top softer, because you probably have a little bit more sensitivity, and we are going to do this, more or less for 3 or 5 minutes, depending on how comfortable you are. Then, usually in this injury, tingling and discomfort in the palm of the hand is quite large. Then, with the edge of the spoon, we are going to grab ourselves. We have a little bit of the cream, and we are going to make just on the border of the palm, a little scrape. We are going to scrape there. A little bit. This technique is a little bit more intense, more vigorous, but it does not have to be very annoying, so if it hurts, we loosen it a little bit or we don't do it at all. And then, as I said before, the tingling you will notice in the first 3 fingers. And in the middle, the 4th, then we take a little bit of cream over there. And we are going to do the same scratching technique towards the inside side of the hand. We are going to scratch there a little bit. Very sensitive area. In the palm, we have a lot of nerve endings, so do it with the intensity you want. So do it with the intensity that you feel comfortable. Do not hurt yourselves doing this massage because the objective is just the opposite. Everything here is completely different. We stay here. A couple of minutes, both towards the middle of the 4th finger, towards the 3rd, towards the 2nd, and towards the 1st, towards the thumb. So in total, we summarize, we have 3-5 minutes of longitudinal passes around of the carpal tunnel area, both on the sides and a little bit on the top. And then we move on to the scratching phase. We're going to do that right in the crease of the hand, right down here, a minute or 2, and then a little minute or 2, and then another minute or 2. Doing the scratching towards the fingers involved, which is the 4th one. The 3rd, the 2nd, and the 1st, and that should relieve your symptoms quite a bit. And a very interesting question that I get asked a lot is what can cause carpal tunnel? Well, the reality is that because of our anatomy, the carpal tunnel serves as a passage for the median nerve and the tendons that provide finger mobility. Along with the median nerve, several tendons also pass through this tunnel, enabling finger movement. As to our wrist, then when that space is reduced, generally maintain positions as it can be the position of the mouse, or it can be very habitual gestures with the hands. The nerve has limited space, but the nerve has less space, has less sliding, and it is going to give us all those symptoms: tingling pain or to look towards the hand. Tingling pain or looking towards the hand. It really occurs because in this tunnel we have little space, and if we reduce it even more in our day-to-day life, then the nerve is going to end up complaining a little bit. I had made a prior commitment to you, promising that we would engage in exercises aimed at addressing this problem. Thus, let's proceed accordingly. Our objective is to find an object that can support the forearm while allowing the hand to extend outwards. And the first exercise that we are going to do from here is very simple. The only thing we are going to do is to open and close the hand 10 or 15 times, and we are going to repeat it 3 times. We do 10 or 15 times, we rest, it would be 1 set, and then we do 2 or 3 series. We are going to start with this, activate the musculature and generate sliding of all the tendons of the fingers. The second exercise that we are going to do is going to be a flexion of the wrist that we're going to do in sets of 10. And if it bothers you a lot, if you are very irritated, you can do it like this without weight. If not, you can take something that weighs a little bit. You can see here I have a little bit of weight, and we can add weight progressively but maintain a proportionate limit. It's not painful. Then we're going to do it 10 times, and we would also repeat 3 sets. Next exercise that we are going to do is very similar to the diagnosis we have done at the beginning. However, we plan to dynamically generate the sliding of the nerves for a more interactive and engaging experience. We are going to start in the position that I have told you before the Phalen Test. We will change it towards the inverted Phalen. First, we separate the dorsum, then the fingers and toes. Separate the fingers and toes. Then we are going to separate the fingers. We join the palms together, and finally, we raise the elbows. Okay, we go down and down. We are going to join the back, and we are going to be approximately between 30 seconds and 1 minute, depending on how comfortable you are doing this exchange. Doing this interchange between one position and the other. Before, as it was a maintained position, so it had to generate you symptoms. Now, as what we are doing is to change it very often. Backwards, it should relieve you because we are generating slippage of the nerve within the nerve inside the tunnel. And to finish our exercises, we are going to do stretching of the musculature involved. The first one, the whole part of the forearm on this side, then simply with the elbow stretched, we are going to take our fingers and we are going to maintain this position, okay? You have to feel a stretching sensation here, even in the palm of your hand. And we are going to hold it for 30 seconds, and we would do it in 2 series. Okay, next, which is very similar. We're going to stretch the muscles involved in the thumb. So now what we're going to do is we're going to take our thumb and we're going to stretch it backwards. Thumb and stretch it backwards. Now the stretching is going to be more focused in this area, and exactly the same. We are going to hold it 30 seconds for 2 sets. Okay, we have already stretched. The next thing we are going to do is neurodynamics. What we want is to generate. I will briefly introduce it here, but for more detailed information, I will provide a video link to ensure brevity. The video will allow me to explain in more depth without taking up too much time. We are going to take this position. The palm is going to be tucked inwards and the head in the same direction as the hand. Then when the hand comes this way, the head goes with it. The head goes with it. Okay, and here we are going to make around 15 to 20 slides. And we would do a couple of series. If it bothers you a lot, you can lower the hand a little bit, if not better here in 90 degrees. Create the slide by generating it. Another question we are often asked is what happens if the carpal tunnel is not treated? Well, the reality is that, as I have explained before, it is going to be a compression of the nerve as it passes through the carpal tunnel because of the little space it has with the carpal tunnel. Because of the little space it has with the tendons, then if we do not treat it and we do nothing to remedy it, this compression is going to be greater each time. And when being greater, it is going to generate us more symptoms until the moment arrives. That directly we will not be able to use practically the hand because we have a lot of pain. And in those cases, it usually ends in surgery. So if you start having tingling and carpal tunnel symptoms, treat it as soon as possible. And in relation to the previous question, what should a person with carpal tunnel not do? The truth is, one must avoid positions that cause numbness and pain. Also, positions that worsen symptoms should be avoided. Each of these positions should be avoided to prevent discomfort and worsening of symptoms. Because those positions are those that are going to generate greater compression in the whole area, and the more compromised we have the nerve, the more serious the injury is going to be. Avoid gestures to lessen injury seriousness. We have to try to avoid all the gestures that provoke the symptoms. And now we are going to go with some general recommendations that are going to help almost all of you. First of all, it is very common that this is associated to the workplace by a bad ergonomics is going to be very important. Ergonomics. It is going to be very important that we try that. The wrist is as flat as possible, and it is not like that. For that, we can use. To enhance ergonomic comfort, consider using a cushion for wrist support or opting for a vertical mouse to rectify hand posture. Second recommendation, as I have said before, it is a pathology that cures with nocturnal pain. The most normal thing is that at night your hands hurt and fall asleep. If that prevents you from sleeping, the normal thing is that the doctor indicates you some rigid cells that are going to support the position of the wrist so that your hands do not fall asleep and you can have a better quality of sleep. And finally, the last recommendation is that these techniques that I have mentioned are very useful, but the ideal is that you combine these recommendations with a good treatment with your physiotherapist, as this will make the symptoms reduce faster. That the symptoms are reduced faster and we go little by little recovering your injury. Having seen this, if you like the video, please leave us a nice like. If you have any doubt that has arisen, you leave us a comment and give the little bell subscribe, and so you find out about all the videos that we are going up. As always, we say until next time, goodbye.